Hello and welcome to today's MSc Respiratory Clinical Science Open Day. Thanks so much for joining us. My name is Kate Thomas. I'm the Events Officer for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We're hoping this session will address those course-specific questions you may have and will help you to gain an insight into what it is really like to study on our exciting Respiratory Clinical Science MSc programme. I'm delighted to welcome today's speaker, Dr. Vitor de Souza Teixeira, who is here to address any questions you may have about our MSc programme. And there will be plenty of opportunities for you to chip in today throughout the session. This session is being recorded and will be made available on our website following today's event. We're here to respond to questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speaker, we have Dr. Vitor de Souza Teixeira. Dr. Teixeira is an Associate Professor, Director of the Respiratory Clinical Science MSc Programme, Tutor for Postgraduate Taught Degrees, and the Deputy Postgraduate Research Tutor at the UCL Division of Medicine. His roles include designing and leading the MSc Respiratory Programme. He teaches immunology, lung biology, and respiratory diseases across the core modules, as well as overseeing research projects. Thank you so much, Vitor. Now over to you.
Thank you, Kate, for the lovely introduction. Let me share my screen. Can you all see my screen?
Yeah.
Perfect. So as Kate said, I'm Vitor Teixeira. I'm the Program Director of the Respiratory Clinical Science, MSc. I also lead the research group at UCL Respiratory Medicine Department. So my area of expertise is lung cancer. So I've been doing lung cancer research for the past 13 years, trying to understand the molecular and immunological basis of lung cancer progression. At the moment, my research group is focused on understanding the role of microbiome in lung cancer progression. So let me welcome everyone to this MSc Respiratory Clinical Science Q&A session. So let me talk a little bit more about this program. So why it's important to study respiratory medicine? So unfortunately, more than 1 billion people across the world suffers from a respiratory illness. And sadly, in UK, every 5 minutes, a person dies from a respiratory disease. So we need to train students, we need to train scientists and clinicians in this specific field. We want that in 10 years' time, we'll have world-class leaders in respiratory medicine. So this program will teach you the scientific and clinical basis of respiratory medicine. So all the modules are focused on understanding the basis, the scientific basis and clinical basis of different respiratory diseases. So this program will be taught by lecturers and clinicians and pharmaceutical experts within the UCL Division of Medicine, UCL Respiratory, UCLH, UCL Hospital's Thoracic Medicine Department, and the Royal Free Hospital Respiratory Department. So you'll have access, as I said, to all experts in respiratory medicine research, also to respiratory clinicians and pharma experts. So we deliver this program with innovative teaching that I'll speak a little bit more later on. And for your research project and for your lab-based tutorials, you'll have access to the amazing UCL Respiratory Department labs. So how the program is structured. So in term 1, this is the term that I call the scientific term. You'll have 4 different taught modules, including the principles of immunology, principles of inflammation, the tissue repair and regeneration, and the statistical methods in research. So you can see here in this image, the photos of your model leads. In term 2 is the clinical term. So you have another 4 modules, another 4 taught modules, including the principles of respiratory biology, respiratory disease and conditions, and the drug discovery in respiratory medicine. I'm leading all of these 3 modules. You have another module called Practical Laboratory Research Skills, led by Professor Jill Norman and Dr. Joanna Donovan. In term 3, you will do your lab-based or clinical research project. So in the principles of immunology, inflammation, and tissue repair and regeneration modules, you will learn about the complexity of this multicellular process and multi-organ aspects of inflammation, infection, immunology, tissue repair, and tissue regeneration in both health and respiratory diseases. So to understand why pneumonia takes place, why you develop pneumonia, you need to understand what's the role of a B cell, what's the role of a T cell, a macrophage, how a bacteria can infect your body. So you'll learn all of this in these specific modules. You'll have also a statistical methods in research module in which you'll learn different mathematical formulas, models, and techniques that are used in statistical analysis of raw research data. This is very important because you'll understand how to analyze, for example, clinical trials data. You also have in this module an introduction to bioinformatics analysis that more and more these kind of omics approaches are used in precision medicine. In term 2, in the principles of respiratory biology module, learn about structural characteristics and the complex cellular molecular mechanisms and the physiology of the respiratory system. In the respiratory disease and conditions, you'll learn all about different specific diseases, the key scientific and clinical aspects of idiopathic pulmonary fibrosis, lung cancer, COVID-19, chronic obstructive pulmonary disease, asthma, ILD, pneumonia, tuberculosis, alpha-1 antitrypsin deficiency, pediatric respiratory diseases, and sleep apnea. So in this module, you'll learn more about the science and the clinical aspects that are involved in these specific respiratory diseases. Finally, in terms of the drug discovery respiratory medicine module, you'll have access to pharmaceutical experts. They will deliver different lectures in which they will explain the scientific and pharmacological basis for the discovery and development of novel therapeutic agents in respiratory diseases. You also do the practical laboratory research skills module, in which you'll learn different experimental techniques that are required in the wet lab. And this includes, for example, isolation of DNA, RNA and proteins, cell culture, flow cytometry, PCR, qPCR, Western blot, and so on. You also learn more about lab health and safety, experimental design, and research ethics. So this module will prepare you to the research project that will take place in term 3. So in term 3, you'll have access to the wonderful UCL respiratory laboratories. So in the UCL respiratory department, currently we have 3 different centers: the Lungs for Living Research Center, the Center for Inflammation and Tissue Repair, and the Center for Respiratory Biology. And each center is developing specific research in respiratory medicine. For example, the Lungs for Living Research Center leads research in lung cancer, airway stem cells and tissue repair, lung regeneration and development, and clinical trials. The Center for Inflammation and Tissue Repair does research in respiratory cell and molecular biology and respiratory infections, COPD and bronchiectasis, and ILD leukocyte trafficking. Finally, the Center for Respiratory Biology leads research in the antitrypsin deficiency syndrome. So you'll have access to specific projects included in these different centers, and you will, in term 3, be able to use these amazing labs that we have at Respiratory Medicine. So what about the innovative learning? So you'll have the traditional classroom. We will teach you, the lectures face-to-face, and you'll have some homework to do. But we also have what we call the flipped classroom. In this flipped classroom, we will give you some homework, for example, some problems for you to solve. For example, you'll be asked to present a journal club or a poster presentation or oral presentation, and you will deliver and will solve all these problems in activities, learning activities that we call tutorials. Okay. So these skills, what we call, the transferable skills, will allow you to be able to present, a research paper, to do oral presentation of your research project data, and will prepare you for future jobs. We'll also deliver clinical tutorials, and this will take place at UCL Hospital and the Royal Free Hospital. So you'll have access to the UCLH Lung Physiology Lab. And during these clinical tutorials, you will learn how to perform pulmonary function tests, for example, spirometry or gas transfer tests, and you'll learn how to analyze the results of these tests. You also sit in diagnostic sessions. For example, you have different clinicians here. Professor Sam James will deliver a lung cancer diagnostic session, Professor Jeremy Brown in respiratory infection, Professor Joe Porter for ILD, and so on. You also observe UCLH respiratory procedures. So you'll observe, for example, a bronchoscopy in the bronchoscopic room at UCLH. And you also attend weekly UCLH respiratory multidisciplinary teams meetings. We also perform 2 lab-based tutorials. Each tutorial takes around 8 hours to perform, in which you'll learn how to do some basic cell biology assays, working with human bronchial epithelial cells, for example. You'll also be able to do immunofluorescence or histochemistry, in which you will identify the different types of airway cells. So where is the program taught? So we are part of the Division of Medicine, and 3 modules will be taught at the Royal Free Campus in UCL Medical School that is located in London, in Hampstead, in London. And 5 modules will be taught at Bloomsbury Campus in central London, in which you have as well UCLH, the hospitals, which is 2 minutes away from the UCL Respiratory labs, in which you will do your research projects. So after you finish this degree, you can apply for different types of jobs. For example, you can apply to do a PhD. You can do some biomedical research, be a research assistant in academia, in faculty level, or in biotech or pharmaceutical. You can also apply to medicine or be a clinical scientist at NHS. You can apply for public health and clinical trials or health-related organizations, for example, charities, scientific publishing, and science communication. The number of these, our 14 out of 15 students were able to find a job straight away after completion of our program. So I will leave this slide on for 20 seconds for you to see some quotes, some very kind quotes from our past students. So if you need more information about how to apply to this program, you can check these 2 websites here. You can also contact our amazing academic administrative team, and they will answer all your questions. And yeah, thank you very much for attending this presentation, and I'm more than happy to answer all the questions that you have. Thank you.
Thank you so much, Vitor. And that was such an excellent presentation. I'm sure you've given everyone a good overview of the content of the program as well. So thank you so much for that. I do have a question for you. So I'll kickstart that. So I'm quite interested in hearing about what you are looking for in kind of an ideal application or a personal statement. Do you have any tips at all?
I think the most important tip that I can give you is about showing motivation and showing excitement about joining the program. I'm looking for applicants who are excited to join this specific program. Of course, everyone who did a bachelor degree in a relevant subject, for example, respiratory care, therapy, advanced respiratory practice, or in life science, medicine, chemistry, and so on, can apply to this program. But, what I'm looking, again, I don't want to repeat myself, is, candidates who are really keen to join us at UCL, really motivated and excited to learn and gain knowledge about this specific topic.
So basically, you're just looking for the most enthusiastic students that are really looking to hopefully start a career in this field and just follow that excitement really and show it in their application.
Because as I said during my presentation, we want to train students, right? We want to train scientists, clinicians. We want to have world-class experts in respiratory medicine. We have a lot of people dying from, a range of respiratory illness and diseases. So we need more research, we need more drugs, we need more therapies. And, to be able to do that, you need to be extremely motivated and excited and extremely motivated to learn and gain knowledge about respiratory medicine.
So in terms of obviously enthusiasm and being really motivated are great to show in the application. Do you recommend any further reading or do you think that any activities could help to inform a personal statement that a prospective student's submitting?
Yeah, if, I believe students will have, life science or respiratory background will be able to, to do well in our course. Of course, someone from chemistry or physics, if they are motivated, of course, there are different books and different papers that they can read, but we are here. We are here to support all the students. We are here to give all the reading lists. We are here to teach and answer all the questions that the students have. So I think, at this point is, have an open mind, be excited, keen to come to UCL, and we'll do the rest.
That's a really important thing to remember, because I think some people can feel quite pressured into doing a lot of reading and making sure they back up certain sources in personal statements. That's really good to hear.
I can give you a couple of examples. I had students in the past years who never had lab experience, right? Never been in the lab before, and they did wonderful research projects because we have a module in term 2 that trained them how to do specific basic research techniques in the lab. And after they were so excited to join us in the lab, they were keen to learn and they did wonderful projects. And they never handled a pipette before, which is, the basic equipment that we have in the lab. But, nonetheless, they were great in the lab. Of course, we also offer clinical projects, more, desk-based projects. But we have wonderful supervisors that will teach the students during the research project.
Fantastic. And actually picking up your point about research projects, so that's another question actually that I have for you. Do you have any examples of research project topics that are that current students are working on? I know obviously prospective students would be really keen to hear about those because those are quite exciting.
So we try to offer research projects in every specific disease that we are doing research at UCL Respiratory Medicine Department. So for example, we have projects in idiopathic pulmonary fibrosis, we have projects in interstitial lung disease, alpha-1 antitrypsin, chronic obstructive pulmonary disease, lung cancer, airway stem cell airways regeneration as well, tuberculosis. So a range, we touch in a lot of different research projects. Only to give you an idea, this year we put forward 22 projects, in different types of diseases. So the students will be able to choose their topic of interest as well. And of course, if there is a topic that we cannot cover and they are really interested to, I'm sure that I'll be able to find a supervisor who's keen to teach a student in a specific respiratory topic.
Gosh, how to choose, I guess, between those. You said 22 topics, so that's and that's just at the moment, so that's really good to hear. And another question that I do have for you is, do you know roughly what the split is between lectures, tutorials, and self-directed study?
So term one is we have 16 hours of teaching activities. There are some independent study, as I said during my presentation. Term one involves a lot of homework. When I say homework, we want the students to be able to present a research paper, for example, do a journal club. We'll give the students a topic for them to do an oral presentation or a poster presentation. So all of these transferable skills, the students, they need to learn because they need to use these skills in the future jobs. It doesn't matter if you are a clinician or if you work in a biotech or if you do your PhD, you'll always need to present your data. You always need to present patient cases. So these skills are very useful for you to learn. In term two, the timetable is very busy, so there is no homework involved. So the students don't need to do any extra activities at home, but they have almost every day, there's around 30 hours of study included per week. So, sorry, not study, of teaching activities per week. So it's a very busy timetable. Term three is the research project. So it's, it's a job. It's a 9-to-5 job. The students need to be in the lab, but they will have time, of course, to write their dissertation and to prepare their viva, because at the end of the program, they'll have oral presentation. They have a MSc viva.
Fantastic. And in terms of, so with, obviously, this is your area of expertise. I'm just curious to find out what drew you to this field, what inspired you to go into this industry as such?
So for me, it's about patients, to be honest. For me, it's about saving lives. And, I'll be the most happiest person in the world if my research will lead to a new diagnostic test or will lead to a new drug, or, I will find a new molecule to be able to, save people's lives. And I think people comes to, a medical topic, doesn't matter if it's respiratory or liver disease or other types of, diseases. I think that they want to be able to save patients' lives. And it's every day that I wake up, it's my motivation is, of course, teaching is a very important part. Because I want to teach students. I want to teach people for them to be able to do what I do, and to be able to develop new treatments, to discover new therapies, to discover new diagnostic tools. So, but in conclusion or in summary, it's about patients. It's about be able to improve the quality of life of these patients and be able to treat them and to save lives.
That's fantastic. Well, I'm feeling very inspired by that. And yeah, definitely to echo that, the fact that your research could save lives or develop a, technology or anything, it's just so exciting to know that actually that could have such a big difference. And being at UCL as well, obviously you're in a home full of the researchers at the top of their games, so you're really in the thick of it in terms of research, which is fantastic, I think. But
yes, it is. I'm very lucky to be able to work at UCL. It's one of the best universities in the world. I have access to world-class experts in different fields, not only respiratory, because at the end of the day, research should be about collaboration, should be about engagement and exchanging ideas and taking part of or be involved in others expert research as well. So yeah, I'm very lucky. We are a wonderful university, very inclusive, very diverse, and yeah, very lucky to be part of this wonderful environment.
That's always lovely to hear. And I don't know if, Vitor, if you had anything else you wanted to add to obviously our questions, or anything you wanted to elaborate on, but equally, if
yeah, no, what I want to say is, thank you all for attending this Q&A. Please don't hesitate to contact me if you have any further questions. I'm more than happy to, set up individual meetings with future applicants. You have my email on the slides. If you have any admin questions, please don't hesitate to contact our administrative team. The email is also in the website that you can find in the slides as well. And yeah, I look forward to meet all of you in October next year.
Definitely. And I just wanted to say thank you so much, Vitor, for taking the time to present such an excellent session. And thank you to everyone that's tuned in to watch this event as well. We are just thrilled and really hope to see some of you, if not all of you, at UCL soon. So in the meantime, just to say thank you so much, and we hope that you have a lovely evening.
Thank you so much, Kate, for organizing such a wonderful session as well. And yeah, have a nice evening, all of you. Thank you.
Take care.
Bye-bye.